Hello, I'm Dr. Ankit Parakh and I work as a consultant in pediatric pulmonology, allergy and sleep medicine at Children's Chest Clinic, New Delhi. In this video, we'll talk about obesity or overweight children and an associated problem which is called as sleep apnea. Now, the incidence of sleep apnea in children who are obese or overweight is significantly higher as compared to normal children. So around the world, sleep apnea is seen in approximately 1 to 2% of normal children. On the other hand, if the child is obese or overweight, then the incidence of sleep apnea could be somewhere between 25 to 40%, which means that out of 100 children who are obese, approximately 25 to 40 of them will have the problem of sleep apnea, and that's quite a high number. Now let's understand why children who are obese, why are they more predisposed to having sleep apnea? So children who are obese, they have a lot of fat which is deposited around the neck. Now that can compress the airway and increases the chances of having sleep apnea. Now in addition, it is also seen that children who are obese, the fat can get deposited around the airways and not only in the neck. That is another cause of sleep apnea. The third reason why sleep apnea is more common in obese children is because of the fat deposition in the chest, and because of that, the movement of the chest decreases during sleep. Now, children who are obese or overweight, what are the signs and symptoms which tell us that the child might be having sleep apnea? So if the child is overweight or obese and has a persistent snoring at night, that is a good marker or starting point for evaluation. In addition, children can have disturbed sleep. They can be frequent arousals from sleep. They could be sleeping in extended postures. They could be sleeping while sitting. They could have daytime problems like poor school performance. They can have excessive somnolence, or they are very sleepy during the day, or sometimes they can be very hyperactive during the day. Now, if a child has sleep apnea, then what can be the complications which can happen in obese children? So there could be problems associated with sleep apnea, like they could develop high blood pressure, they could develop something known as pulmonary hypertension, or where the pressures inside the heart can increase. They could develop metabolic problems like diabetes, they could develop problems like high cholesterol, and the obesity itself is a problem. And as we understand, obese children or obese adolescents, they have a very high chance of becoming obese adults. Now, if a child is obese and has any of these symptoms which we have talked about, the child needs to be evaluated properly. Now, the best investigation for evaluating such a child is to get a sleep study done, which is also known as a polysomnography. This is usually an in-lab polysomnography where we attach a few sensors while the child goes to sleep, and there's an overnight monitoring which happens. We also have a video on our channel which talks about polysomnography in detail. Now, if a child is found to have sleep apnea, then how do we treat it? So the first step is to look at the adenoids and the tonsils, and if we find that the adenoids and tonsils are enlarged, then we would usually take an ENT opinion, and the child might need to undergo an adenotonsillectomy. Then a sleep study is usually repeated after a few months to see how much residual sleep apnea is there, because a lot of children who are obese, the cause of sleep apnea could be multiple. And if there is a residual sleep apnea, then the child might require something known as a CPAP during sleep. It is a small machine which is to be used with a mask, and with the help of this, most children will remain well. Obviously, reduction of weight is the most important factor which also needs to be borne in mind. So, if you have an obese child in the family, and if the child has any of these problems which we have talked about, do consult your pulmonologist or sleep specialist and get a sleep study done to evaluate him for sleep apnea. For more information, you can log on to our website ankitparakh.com. Thank you.